cameras. Now I invite upon Dr. Shishir Agrawal. He'll be talking about the ultra wide field fundus photography and how to become proficient in uh, fundus photography. Dr. Shishir.
Good morning, everybody. Thanks, Dr. Arun, for enrolling me for this course. So now we delve a little into the posterior segment photography. I have no financial interests, and I have taken a few slides from KLB, Zeiss, Optos, Remedio, and Trinetra. So in fundus photography, we know the illumination and reflectance of the retina occurs through the common optical path, that is the pupil, and you do it through different color filters or through dyes for fluorescein angiography and ICG, indocyanine green angiography. So it's a fundus camera is a low power microscope with an attached camera. It's sort of a uniocular indirect ophthalmoscope. So normally an angle of 30 degree would give an image which is about 2.5 times larger than life. So normally the routine fundus camera, they give a view of about 45 degrees or so. And the newer ones which are coming in are the wide field ones. So just for comparison, we have this 20 degree, a 40 degree, and a 60 degree view. So in the fundus camera, we have a light generated either a viewing lamp or by an electronic flash, and this is projected onto the filters, and through this path it goes into the eye of the subject, returns back, and here it is captured, and we see the image as well. So we adjust the eyepiece and focus the fundus camera, and then the reticule is focused to give a very sharp image finally. We get good photographs. So the history, Dr. Arun told a bit about it, and so it was in mid 1800s and in late 1800s that this thing started developing. So we do a color photography where a white light is taken, and monochromatic where it could be blue, green, or red. So the basic principle is that the blue, it will take care of the epiretinal membranes of the superficial retina. Green will more take care more of the inner retinal layers, and the red has more penetration, so it would do the choroid and the posterior, the outer retinal layers. So that is the basic principle. So red free means a green light. So there would be a green filter, the red would be blocked, and so you usually do a red free thing for the retinal pathologies. So fluorescein angiography, we know there is an excitation light and fluoresces a yellow light. Then indocyanine green, where an infrared diode laser is used, 805 nanometer is used. And stereo fundus photography, not much in use, but you take two photographs of the same thing with in two slightly different angles, and you see through a 3D. So these are the traditional fundus cameras by Topcon, Canon, and others, and you typically have a 45-degree view in these. Trinetra is another one. They have this Forus fundus camera. So this, I have no financial interest in any of these products. So the company is Trinetra, and they have this Flora fundus camera. They mount this thing on your slit lamp mount. They remove the slit lamp and put it over there. Gives good photographs. It has angiography provision as well. Then you have these non-mydriatic fundus cameras now. No pupillary dilatation is required. It is comfortable to the patient. No sensitivity to light. It is less time consuming. There are more accurate pictures. It is cost effective. Smartphone photography, as Dr. Arun and Dr. Seth had told. And then telemedicine is possible for screening purposes. So Remedio is one which supplies these type of cameras. So it is a handheld one, can be mounted onto the slit lamp as well. Right. And now they have come up with two more cameras, 5.0 and 1.5. I was seeing yesterday, they launched yesterday. So 5.0 is a normal full fundus camera, tabletop. And 1.5 is through small pupils for screening purposes. And gives good photographs. So next thing, the new thing is the ultra wide field retinal imaging. So perhaps what indirect ophthalmoscopy did for retina in the times of direct is what this is doing probably to the normal fundus images. The wide field has much bigger view and a wider view, a bird's eye view, and you can see the peripheral pathology. So wide field is, it goes on from 45-50 degrees up till 100 degrees, and ultra wide field is up till 200. So the newer definition being, if you can see those all 4 vortex vein ampullae and beyond, then it is ultra wide field, and less than that is wide field. So more than 80% of the retina you can see through these, and through small pupils. You can make out the peripheral vasculature and the other peripheral lesions. So there are many advantages. There is an enhanced resolution, a shorter image processing time, faster acquisition. So many advantages for small pupils, for non-compliant young adults, pediatric patients. So it has many advantages, and it has this CSLO system, confocal scanning laser system. So we have in the market today Mirante by Nidec, Clarus 700 by Zeiss, Optos, and the fourth one is Ideon. So a little about these so I am using Mirante, and so it has this wide field thing. So it has the normal color images, the ultra wide field, and it has monochromatic imaging as well, and then this dynamic FA, ICG, and fundus autofluorescence, and then it has a new thing, a retro mode, and then Octa, OCT, and Octa as well. So it has this attachment here, the ultra wide field attachment. So this Mirante with this attachment, it will give 163 degrees in one shot. And if you take a montage, it can give somewhere between 210 to 220, 30. So gives good images, and can go up to the aura as well with a small pupil. So wide field, ultra wide field angiography, and ICG as well. Just to have an idea. So comparison of the 4 ultra wide field which are available. So here in Mirante, it was with a single shot, it was 163 degrees. In Clarus 133, and with montage, they claim it to be more than 200. And Optos has a single shot of 200. So horizontally, it has a more wider angle, and superiorly and inferiorly, it's a little bit less. you have to make a montage for that. So for the Clarus is this, and the Edon, it has actually, they have an attachment now, and it gives an angle of 120 degrees, and with montage about 200 degrees they claim. A few photographs by Dr. Bavankule, published in various journals. A little about Clarus. So it will, Clarus will give about 133 degree in a single shot. So with montage, above 200 it goes. These are a few photographs. So these are all comparable with a little plus point in one and a little negative in the other. My time is over. Right. This is a case of detachment, case of diabetic retinopathy. So the images are good. A little about the optos as well.
You finished?
Just another minute.
चलें तो चलें.
Few seconds, in fact.
जो लोड किया वो ना.
So optos gives a wide field,
वो इसका ओहो इसका लैपटॉप.
200 degree in one shot.
सतीश.
And with regard to Edon, so as I said, they have put up a lens, and it is about 120 degree in one shot and can go on up till 200. And then we have the red cam for the babies. It covers about 130 degrees or so. That is it. Thank you so much. No, OCT is only central. So about for the octa is 12 millimeter maximum. Octa is 12 millimeter. OCT angiography. Please.
Thank you, Shishir, for your elaborate talk on fundus viewing systems and how to go about